Artificial disc replacement, or the medical term is called total disc arthroplasty, means that instead of doing a fusion of the spine after taking the disc out, we're actually putting in an implant which mimics natural motion. And so these devices are available for both the cervical spine and the lumbar spine. But the cervical discs are much better, and so they're more commonly used. The lumbar disc, at least the current forms that we have been tested to be equivalent to a fusion, but not necessarily better. And because of that, there's some challenges in terms of insurance approval. Plus, I think most spine surgeons aren't quite sold on it. And so because of those both factors, I think lumbar artificial discs really haven't taken off. Cervical disc or artificial discs, I think, are much better, and at least in my practice, it's really taken over. I saw a recent study, actually a survey that was done amongst spine surgeons in America, and for whatever reason, though, I think the great majority still do more cervical fusions than artificial discs, despite the fact that, I think the cervical arthroplasties are better. And obviously there's probably different reasons for that, but I will tell you that the artificial discs for the cervical spine, there's been several studies that show that it leads to lower rates of reoperations within 5 years. And the reason for that is, the thought is that the artificial discs will decrease the chances of what's called adjacent level disease. Although the cervical fusion surgeries have been a mainstay of how we treat cervical disc herniations over the last 3-4 decades, and most people have done pretty well. But one of the problems with the surgery is that a certain percentage of these patients, we believe, will have a symptomatic disc herniation at the next level, just because when you fuse a disc, it transfers the pressure to the levels above and below. But the artificial disc, because you're still having some motion there, will decrease that adjacent level stress significantly by factors of 2 or 3. And so patients have much lower rates of reoperation at the next level, 5, 6, 7 years down the line. And because of that, I started doing that surgery as much as I can. It's not for everyone. You have to have the appropriate patient. But the patients that fit criteria, they've done very well. Patients are recovering much faster. So, and it's been dramatic. I tell patients for the anterior cervical fusions for the neck, recovery process is usually about 1 to 3 months in terms of going back to work, just because you have to worry about the fusion. Although the anterior cervical fusions are an outpatient procedure, we're still a bit careful about letting people go back to work right away, especially if they have a physical job. Like if you're in construction, if you're a firefighter, things like that, you have to really be certain that the healing has taken hold enough before you let them do things like that. Because if they go back to work too early, the fusion can fail, and most commonly they'll have a lot of pain. With the artificial disc, what I've been seeing is people are getting back on their feet and working within hours to days. I mean, I've had patients who, will be doing push-ups and jumping jacks, and they want to go back to work. And these are some of the, not so normal special forces guys and people like that I've operated on, and they're young and healthy, and they're, obviously they're very motivated. But even for just the average person, I've had construction workers who normally are very hesitant to go back to work too soon because their jobs are so, demanding. I had one guy come in dancing the jig because he wanted to go back to work a week after surgery. I mean, he was so pleased, And so I think that's where I've seen the most dramatic difference for the artificial disc in the cervical spine.